If you're using Eroxon Gel regularly, or even just considering adding it to your routine, there's a really important question you need to ask yourself, and frankly, you deserve a clear answer. Is it actually safe for long-term use? We're talking months, even years, of consistent application. You're definitely not alone in wondering about the safety profile of this product, and the truth about its long-term effects might genuinely surprise you. There's more to the story than you might think, so let's start with the basics. What exactly is Eroxon Gel? What makes it different from other ED treatments? Eroxon is a topical gel, meaning it's applied directly to the skin. It's designed specifically for men who are dealing with the challenges of erectile dysfunction. It offers a different approach to managing this common condition. Unlike the classic pills you might already know, like the widely recognized Viagra or Cialis, this gel offers a more localized approach, working right on the surface of the skin. The key here is all about direct absorption through the skin. This direct absorption helps to get the blood flowing to where it's needed, often within just a few minutes. It's designed for rapid action. But the big question that lingers in everyone's mind is, what happens if you incorporate it into your life, using it every day or every week consistently for months at a time? Does the safety profile change? Let's break it down and take a closer look at the available data. Eroxon has indeed been clinically tested, but primarily for short-term use. These trials typically span somewhere between a few weeks and up to about 3 months. That's the extent of the data we have from controlled studies, and the good news is that so far, no major or alarming side effects have surfaced in those clinical trials. This is certainly encouraging. The real difference between Eroxon and other ED treatments? It lies in the fact that its ingredients are considered non-systemic. That essentially means that the active components don't circulate extensively throughout your entire body. This is a key distinction from the chemicals found in traditional ED pills, which are absorbed into the bloodstream. And for most guys, that's generally good news when considering potential side effects. Medical experts and researchers believe that this localized action reduces the potential risk of long-term impact on your vital organs. This translates to less worry about potential strain on your heart or liver, especially when compared to taking pills regularly. But let's move beyond the clinical trials and consider something equally important. What about the experiences of real users? We're talking about men who've incorporated Eroxon Gel into their lives for periods of 3 and even up to 6 months. Many of these users report that the gel continues to work effectively over time. What about side effects in the real world? The reports suggest they are generally pretty minimal. Some users have occasionally noticed a bit of mild skin irritation or redness in the area of application. However, the good news is that this irritation usually subsides and disappears relatively quickly. Importantly, there's also no evidence to suggest any form of dependency or addiction developing with regular use. Furthermore, users haven't reported the effects of the gel getting weaker or diminishing over extended periods of time. This is a significant advantage, as diminished effectiveness is a common concern associated with some other ED treatments. So, after considering all the available information, what's the final verdict on Eroxon Gel? If you're actively seeking a potentially safer alternative to traditional erectile dysfunction pills with their systemic effects, then Eroxon Gel might very well be worth considering as your best bet. It boasts ease of use, a rapid onset of action, and based on current data, a long-term safety record that appears quite promising. But, and this is a point I really want to emphasize, it's absolutely crucial that you always have an open and honest conversation with your doctor. Do this before you start or continue with any new treatment regimen, especially when you're considering it for the long haul. Your doctor can provide personalized guidance. If you found this information helpful and informative, please go ahead and show your support by hitting that like button and subscribing to the channel. Also, don't hesitate to drop a comment down below if there are other products you'd like me to test and review. Or if you're curious, let me know if you'd be interested in seeing a head-to-head comparison of Eroxon against other similar products. Thank you so much for watching today's video. Remember to always prioritize taking good care of yourself and your health. Until next time.